Our next session will explore the critical role that philanthropy plays in promoting health. Approaches to philanthropy have been changing over the past few decades. Philanthropists are now looking to invest in innovative solutions with a high social impact. Before we meet our next speakers, I want you to take a look at this video.
Maverick Collective is a platform for philanthropists and activists who want to use private financial resources and their particular talent in helping us to solve big problems.
We've affected more than 800,000 women and girls across the globe. We've leveraged over $70 million. We've impacted philanthropy in a major way. We're teaching other organizations to do the same now. We have this 23 amazing women that are doing big changes for women and girls all across the world.
If we invest in girls and women, we'll strengthen local communities, we'll strengthen nations, and we're seeing it unfold through this new model of philanthropy where everyone's working at their strengths. The philanthropist is working at their strength, the development community, NGOs are implementing and working at their strength, and then bringing in other partners like governments and bilateral donors to then help us to scale. So it's a really interesting model and it's efficient.
I think you're set into a more innovative phase of your life. You have this incredible opportunity to get all this new knowledge from all these people. And we're so incredibly grateful to the whole YGL community for enabling us to do this.
When you become a Maverick Collective member, you actually go to the field, you co-own and co-create your own project. So by being so grassroots, you get incredible knowledge of the issue.
One example is Kathy Wiesas, who is one of the first Mavericks we met, the potential candidates. She's worked so hard on this project on cervical cancer.
1 in 5 of the women who are infected with cervical cancer come out of India. We decided that we would pilot this very simple intervention, which is simply using white household vinegar to swab a woman's cervix to detect early signs of cervical cancer. If she was infected, we would simply freeze off the cancer cells. The government of Uttar Pradesh will now be reaching 24 million women, and this is something that we can take and scale not just further across India, but really across the world.
It's an incredible project, and it's all started with Kathy Wiesas' determination to do something for the world.
We're creating champions for girls and women. It's at its tipping point, but it'll have a spiral effect.
Please welcome Dr. Ronald DePinho and Kate Roberts. Nice to have you both here. Kate, I want to start with you because you've been here for the 3 days, as has Ron, and you've noticed something about everybody's story here. There's a sameness.
Yes, I have. Well, I mean, first of all, I should say I'm so incredibly honored to be here, and Dr. Robin Smith is a true maverick. And indeed, I've been blessed to listen to these incredible speakers who are mostly from the scientific and medical world. But what is absolutely clear to me is we're all feeling the same thing. We should not be working in silos. We should not be competing for funding. And if we collaborate, we're going to reach these goals much quicker. And without collaboration, that's not going to happen. And it's the same in philanthropy.
And that speaks to the change in philanthropy that's going on right now, and you represent that.
Huge change. Philanthropists feel lonely. They want to collaborate. They want to learn from each other. They want to learn from organizations. They want to lean in. They don't want to just write checks. They want to really educate themselves, learn, be involved, help solve problems, come up with solutions collectively. And again, we're going to be so much stronger if we take that approach. But what I also see as a shift is, gone are the days of starting to do philanthropy in your later years. Our youngest Maverick member is 22. And so the next generation really want to do this differently.
Can you explain how your approach to philanthropy has made a big difference in the work that you do, as opposed to the sort of old-fashioned way of doing it?
Yeah.
Or the regular way of doing it?
Yeah, I mean, there's nothing wrong with the old way of doing it, but what I see happening in the trends is it's no longer the sort of Band-Aid style of giving. It's not necessarily putting your name on a building. It's really using, your time, your talent, and your treasure to its full capacity. It's using your whole net worth, not just your money. And before, I feel like we were leaving so many resources on the table, especially with women and young successors who are now philanthropists. I mean, there's $22 trillion that will be passed to women and the next generation over the next several years. And people are starting earlier in that giving. And ultra high net worths have become rich for a reason. They've built companies, they've been successful, and they want to take the same approach in their giving and their philanthropy and take a private sector approach to the way they invest their philanthropic dollars.
Ron, why isn't checkbook giving good enough?
It is good. All giving is good, whether it's you have $10 or $10 million, it's all good. It's the way that you give. I think is really important to look at. Really learning about the organization you're getting involved in. My organization, who's the implementing partner of Maverick Collective, we're a huge global nonprofit organization that works in 60 countries on the ground, boots on the ground, 9,000 employees, $600 million budget. But we were traditionally funded by bilateral donors, the US government, big foundations like Bill and Melinda, who also support Maverick Collective, the UK government, big corporations, and so on. But governments and traditional donors do not allow for innovation. And that's where the philanthropist can really come in and test new models so that then organizations like PSI can take those solutions to global scale.
Ron, have you seen examples of where this change in philanthropy has made a big difference?
It's been extremely catalytic, and I'd say the major difference is that both on the project side, you're seeing collaborative models, and it's reflected in this meeting here where different sectors come together, business, government, faith-based organizations, academic institutions, are coming together and trying to synergize, use their collective capabilities for population-level impact. And a similar trend is occurring on the philanthropy side, where you have foundations and philanthropists coming together in a more coordinated way. And the thing that really is catalytic when those two universes come together, it's extremely synergistic because you're speaking to what the philanthropist wants. The philanthropist wants impact more than anything else, but they also want to be engaged. And the level of engagement and collaboration is extremely appealing to the informed philanthropist. So I think, again, gone are the days of just writing a check. Folks want to be involved in the process. They want to be a partner, a part of this process that's going to have a significant impact on humanity. And I think it's really the theme of this meeting, Unite to Cure. It's about all of us coming together. And in a sense, we're all philanthropists. Some of us give our time or our knowledge, others give technology or infrastructure or the ability to enact policies. We heard an inspiring statements from His Holiness today about the importance of being proactive in health and the responsibility of governments and industry and so on coming together. So you have this collective impact, and at the same time you have this collaborative effort to try to enable and fund those really transformative initiatives.
And where have you seen it make a difference?
Well, our one example that we launched at MD Anderson was the Cancer Moonshot Initiative. So here we got together 600 academics over about 6 months where we thought about, is there knowledge today that if implemented would reduce cancer mortality within our generation? And so as a result of that, we identified 53 projects where we were able to, if we had the resources and an appropriate strategic plan, we would be able to achieve that goal within a reasonable period of time. And what we learned from that is that in order to effect that change, It required cross-sector collaboration. You know, we tend to be within ourselves, academic institutions talk to each other,
Right.
or legislative bodies, et cetera. But all of the solutions required cross-sector collaboration. A very simple example of this was, we all know that excessive UV exposure during childhood causes a dramatic increase in melanoma later in life. So you'd think there would be legislative policy that would ban minors from access to tanning beds. There are 24 million Americans that use tanning beds. Okay? 11 episodes of tanning bed use doubles your risk of melanoma. And most of the folks that use it are 17-year-old girls on the way to a prom, and they get irradiated, and they have this dramatic increase in melanoma later. So there's an example where if legislators understood that and were put together with the academics, that the two together would be able to effect science-driven policy that would prevent tremendous suffering later in life.
So it hasn't been a matter of resistance to this change, it's been lack of knowledge.
It's lack of communication,
Yeah.
collaboration, coordination, really the convening part that, for example, your organization has, or an institution like an MD Anderson or the NIH, et cetera. They have this powerful convening capability that can bring together all of these diverse stakeholders who are doing great stuff in their swim lanes, but not really acting in a coordinated way to say, you know, we know what we need to do, how can we actually achieve the goal?
To toot Ron's horn, really, because I know he won't do it himself, you know, when we first sat down together at MD Anderson, the first words out of both of our mouths were, you know what, let's end cervical cancer in our lifetime. And let's figure out how to use your strengths and our strengths and combine those, because no woman should die of a completely preventable cause. So we were so aligned, and even though we're essentially competing for the same dollars, we said, let's bring those resources together. And when telling our Maverick community that, you know, MD Anderson were willing to work with us, I mean, that put a whole new meaning to the work that we were doing, because every actor was working in the right way. And as Ron says, if we do not collaborate with innovation, first of all, but then civil society, boots on the ground, PSI, philanthropy playing its role at that innovation stage, the governments, you know, unlocking domestic financing is key. You know, to give you a really good example on cervical cancer, one of our Maverick Collective members, Kathy Vizas, you saw it in the video, she helped pilot this white vinegar swab, and the government of Uttar Pradesh in India have now taken that on and scaled it through the public sector, and it's reaching 24 million women. I mean, that is the power of collaboration, and if we cannot break down these silos, we're not going to achieve the Sustainable Development Goals.
And you don't believe that would have been achieved without this collaboration?
Well, nobody else has done it, so I'm waiting for somebody to follow suit. We want to replicate this model with other organizations. You know, first of all, there's enough money to go around. The platforms are there. The great minds, the scientists, the doctors are there. If we can just share that data and share that information, we can scale the solutions. And using our minds, again, time, talent, treasure, we're going to get to the goal more effectively and quicker. And there's $3 trillion missing to really achieve these Sustainable Development Goals.
You know, this is a great example of where knowledge is cancer's greatest vulnerability. And when we have these discussions, even with pediatricians who really don't see decades later the consequences of not pushing the vaccine at the right time, that they change their behavior. When I have discussions with parents, you know, we have those that are anti-vax, but the overwhelming majority understand the science. And it's just simply lack of knowledge. And in fact, there's been many studies, but it is a safe and effective vaccine. It is something that both boys and girls need. And it's remarkable, in the United States, only 1 in 6 boys, 1 in 3 girls is vaccinated. So imagine you're now an adult, you have a 35-year-old daughter who is on her terminal deathbed, and you failed to get that individual vaccinated. The real side effect here is cancer. So each year in the United States alone, 40,000 cancers related to HPV, 17,000 cervical and 23,000 head and neck. And we have a safe and effective vaccine that can prevent that from happening, and it is less expensive than caring for those cancers. So both the resources are really in the savings, which is a five-fold delta, and you also get to reduce the pain and suffering, and to, and I have a Catholic faith, and I'm very proud to be Catholic and very proud to be associated with the Vatican. If there was one central tenet of this faith and many others, is to really help serve the underserved. And what you've heard is that the overwhelming majority of those suffering from HPV-associated cancers, 85% worldwide, are the forgotten, the impoverished. And so when you enact these public policies that can lead to preventive strategies, it has a disproportionately positive impact on the forgotten. And there's nothing more important than that, and protecting the future and health and well-being of our children. Right? That's our solemn responsibility as a society. Yet we're not doing all that we can do as organizations to come together to really make those investments.
So has it just been a matter of changing the mindset? Because this sort of seems like a no-brainer to me.
It is absolutely no-brainer. And again, it's really just lack of information.
Yeah.
And now we have great technologies that can disseminate knowledge, through mobile connectivity and so on. These are things that are going to transform. And today we heard an extraordinarily inspiring message from His Holiness. There is no greater bully pulpit than that, right? And I believe that the statements that he made today are going to save millions of lives going forward.
You're shaking your head, David.
Yeah, I mean, I would also add to that it is about changing behavior. It's about everyone changing their behavior, whether you're, we call our beneficiary Sarah, right? Sarah deserves to have a name. And inequality is costing the world billions of dollars. And, this can change the face of the global economy. And we have to change our behavior. I feel like NGOs need to, like PSI needs to change its behavior. And with the Maverick Collective model, we've really turned that model upside down, because before it was NGO gets grant from US government, does work, good work, credible work, writes a report, and more money then comes and we do our work. So what we've said is, okay, we're going to turn that around. We're going to welcome the donor in. We're going to be completely transparent. We're going to be partners. We're going to be stakeholders. And we're going to solve these problems together. That is a behavior change. That is a cultural shift for most global health organizations around the world. And then what we have to say is use these great minds, these solutions that Ron and others are working on here, to then implement on the ground, to scale them. But the other change I feel that really has to happen is we have to take a private sector approach to some of these solutions. And,
why?
Just putting people also create change. Money doesn't, right? I mean, money is essential, but people create change. And if you can just open those floodgates and let the partners in, warts and all, to really figure out how do I get the most out of our partner, that will create a lot of change, and that's going to be hard to do.
For almost anything we learned in the projects that we selected in the Cancer Moonshot, for example, is that it required often government, industry, care delivery systems, venture. And so it wasn't, the money was important, but it was insufficient. You needed that cross-sector capabilities, et cetera. But just to go back to one key point on the numbers, to put it in perspective, the generational impact, economic impact of cancer is $100 trillion. 3 to 4 trillion every year. So over a generation, it's a $100 trillion problem. Up to 50% of cancers can be prevented. So that's, if we did that and did that robustly, tens of trillions would be saved and be able to put back into other things like education and infrastructure, et cetera, as opposed to dealing with the pain and suffering of not having acted.
Go ahead.
Well, I just want to make one point, and we've talked a lot about disease, right?
Yeah.
We've talked a lot about stem cell, we've talked a lot about diabetes and non-communicable disease, which is a new conversation, right? This is very new. However, I think it's important to note that all these health issues work very closely together. They're all interlinked. And if you take the issue of sanitation, for instance, a sixth of the world does not have access to a toilet or clean drinking water. That leads to disease, that leads to cholera, that leads to diarrheal disease. One of our Maverick PSI ambitions is to build, for instance, in India, a toilet in every single household in India. The point here is there's $2 billion locked up in the Indian government that needs to be unlocked. And the only way we're going to unlock that is if we can go to the government and say, all right, here is a system that works, invest in it. And so this private sector approach to, say, building toilets, it's not just about building a toilet in a house. You've got to think about lots of other things, but it all works together. And I don't know whether Ray Chambers is still here, but the work that he's done on malaria, we're now at what we're calling the last mile. PSI in collaboration with what Ray is doing distributes hundreds of millions of insecticide-treated nets, which is just a simple solution that you put over a bed, and it needs to be scaled. But again, we need a private sector approach to really that last mile.
Speaking to the philanthropists in this room who may not have taken on this approach, what do you say? How do they start this process? What do you say to them directly?
Well, first of all, I would say get involved, get engaged. It's critically important because, again, many of the individuals that do have the resources are extraordinarily successful individuals with tremendous creativity, the ability to organize and get things done, et cetera. They also have the ability to hold those different groups accountable, that folks are not just going to get resources, but they're going to be held accountable for those resources.
Has that been one of the problems in the past, that they're not held accountable?
I think that there's this, in a sense, been this, the old school, which is write a check because you're grateful or you love an institution or you love an idea. But the ability to bring the two together, I've seen to be very synergistic and more highly effective in achieving the goals. Because these individuals, these organizations, these foundations, when they come together, they have a lot to give to the process. It's not just the implementers. And then also philanthropists have the ability to convene groups because they stand with the patient. They're impact and mission oriented, but they can bring together industry, government, academic institutions in a way that it's difficult for those individual sectors to do. And so it's a very powerful convening as well as enabling force. And so I say get involved, become knowledgeable, become a partner, part of the team that's responsible for making the impact.
Yeah, I would absolutely echo what Ron has said, and I would add to it, I think this word transparency is really, really important. And I think partnership, we have to somehow create change with the power dynamics of the donor and the charity or the NGO. And for me, this creates a lot of blockages in impact. And I think honesty and trust and transparency are really, really important. And it really is up to the donor or the partner. We don't call them donors or partners, we call them members, because you are a member of the team. And you should be able to have a completely transparent discussion with each other so that also that unlocks the trust of the NGO, or unlocks the trust of the donor. Because again, nobody should be covering up data. Nobody should be covering up mistakes. We should fail fast and then pivot. And with a philanthropist, with a donor, you can do that. You can't do that with a government grant. And so I agree with Ron, leaning in. I always tell our Maverick Collective members, this experience will be as good as you make it. I'm not going to make that experience for you. I'll give you this incredible platform to have global impact and change the world, and it will be your biggest passion. But unless you lean in, ask the right questions, and collaborate, and be truthful and transparent, that experience won't be as great.
But you're putting a lot of people into the tent. that you weren't before. Was it harder to get them in there than you thought it would be, or?
I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in there than you thought it would be. I think it's harder to get them in
not.
It was definitely a culture shift.
Yeah.
There's no question about it. And to a certain extent, it requires a top-down. You know, you have to have leadership and vision. And so philanthropists are in a really very special role. Obviously, His Holiness is in a very, very special role. Heads of state, very special role. Those are the powerful convening entities that can speak to what's right, that are extraordinarily trusted. And those are the ones that we really need to step forward and really change the course of history here. Because I believe that just as 500 years ago, we really changed the human condition here, and what happened in Florence and so on was truly special for what it is to be human. I think centuries from now, when people look back on this period of human history, it'll go down as a major turning point for who we are. That for the first time in our existence, we have enough knowledge of the elemental aspects of biology and disease, not just infectious foreign agents, but our own endogenous biology, that our knowledge is sufficient for us to be able to alter that in a way to improve the human condition and to reduce pain and suffering. I think that that's going to be our greatest gift. And centuries from now, when people look back, it's going to be a major turning point for who we are.
So really, the timing is right.
Yeah.
It probably wasn't before, but now there's this ability to all
And we need
converge.
to unite to cure.
Yeah.
Yeah.
I was extremely inspired by His Holiness this afternoon because I feel that his message was really on prevention. And prevention is, the return on investment with prevention is much higher than curing or treating. And so I would also give advice to the philanthropists in our community is also look at your philanthropic investments also as leverage. You know, we've seen a $1 million gift become a $30 million gift, where we've been able to really measure the data of the results and then bring in other partners to then scale and also bring in new donors. And that's what we want. And so, again, my message to a philanthropist would be challenge the partners that you're working with, challenge the data, and make sure you're using your whole self in your philanthropy. And it's like buying shares in Coca-Cola. If you are going to buy shares in Coca-Cola, you're going to understand how that company works. It is no different with the way that you invest your philanthropic dollars. Be a stakeholder, as Ron said. Learn, get involved, roll your sleeves up, go to the field, see what's happening, experience poverty yourself, and you will be the best advocate.
But you've also, so you said to me before we got out of here that some philanthropists, you're disappointed that they won't actually put their money in certain charities because they have certain demands, and that maybe that's not right to do.
I think what I was saying was, again, with the whole buying shares in an organization, that is what you're doing. And I actually disagree with one of the speakers who she said, don't give to an organization's bottom line. You know, make sure that all the money goes to the field or goes to the research. But, you know, how do you pay your staff? You know, our overhead is only 7%, so we're very lean and mean. However, if I was a philanthropist, I would invest in an organization and not so much in a specific issue and be very narrow with that focus, because you'll stifle innovation.
Do you have any more examples, Ron, that you could give us where you've seen this new form of philanthropy take hold and make a real difference?
One example, and in fact, the last meeting, we had Sean Parker here, and Sean basically brought together half a dozen of the premier institutions to better coordinate, share information, share IP, so that one could drive this revolution in immuno-oncology. And it's been extraordinary. And so he, you know, was a great philanthropist. He brought all of these really august groups together. And it has since been quite catalytic. And it's very impressive, and I think it's really advanced the field, this enormous opportunity. So he had the vision, he got involved, he helped create this new organizational paradigm, and it's been very, very successful. And there are many other things that, you know, some of the great philanthropists have done. Most recently, Andrew Forrest, who was the force behind the efforts to end modern slavery, came together, and we created this Eliminate Cancer initiative. which is, again, cross-sector collaboration, cross-country collaboration, and it has immediately inspired tens of millions of dollars of activity because there was a seed crystal that this great philanthropist has, a good vision, alignment across the different sectors. Folks want the same thing. They're not communicating. We convene, we bring them together, and it has raised an enormous amount of money, and more importantly, we now have strategic plans in the UK, in China, Australia, and so on, that is bringing groups together in a way that will accelerate the translation of knowledge into things that actually matter for patients. No paper, no scholarly paper has ever cured a patient. It's only when that knowledge is converted to new policy, a new drug, a new diagnostic, and to do that, it requires the collective impact of all of us, and in prevention in particular, where the return on investment is really about the human condition and making societies more productive. It's extremely important that philanthropy put their shoulder into that, because that's really the major funder for those kinds of initiatives.
That final call of action, I'll say thank you to both of you.
Thank you.
New face of philanthropy. Thank you, guys.